Well, Sammy Selena picks up our team coverage with a closer look at the people impacted by the $259 million in Medicaid dollars now being withheld. Sammy?
Julie, this is yet another layer of uncertainty that providers and their patients face in regards to Medicaid. And today, there sure were a lot of questions about what this means, but not a lot of answers.
The Department of Human Services was already appealing a federal action to withhold more than $2 billion in annual Medicaid funding when they received what Medicaid Director John Connolly calls a new threat.
What they're saying is, pending the receipt of information from the state to substantiate billing in those 14 services above and beyond the $2 billion in the withholding, they're now saying they're going to withhold, or rather defer payment in federal funds up to $260 million quarterly until we pass through this process.
He says this would be catastrophic for some Medicaid programs, especially since the state is already taking steps to prevent fraud.
The claim that this is necessary to make sure that we're serious about fighting fraud is just not credible.
DHS couldn't answer what programs would be at risk, leaving patients and their families with a lot of questions, including Sarah Limbo, whose daughter with cerebral palsy relies on Medicaid.
As you can imagine, yesterday's announcement about further cuts to Medicaid has left us with a lot of uncertainty and anxiety about her future.
Limbo joined a coalition voicing concerns over Medicaid's future in Minnesota that echoed the same worries as Children's Minnesota's president and CEO, Dr. Emily Chapman.
What does this mean? How does this impact our ability to take care of these families? What programs aren't going to be able to be available? And in that moment, I don't have those answers.
She says regardless of what's at stake, a hit to any program will impact the entire healthcare system.
Behind that, and the anxiety really is, this is just one of several different moves to remove funding from our healthcare and health and human services support systems, safety nets in the state of Minnesota. And so this one was just yet another destabilizing factor.
And Julie, while we wait on DHS to answer what the potential impacts are, the federal government did say that personal care, home and community-based services, they target them as unusually high spending. They're rapidly growing areas, so those are some of the services that they may concentrate on. Julie?
Yeah, and in general, some of the services that were potentially ripe with fraud. All right, thank you, Sammy.